Hello everyone, welcome to Visan's Anatomy. Today we are going to continue with the basics of anatomy, anatomical terms that are used in gross anatomy. The links of part 1 and part 2 are given in the description box below. We learn about the anatomical terms in relation to movements. There are many joints present in the body which helps the body to move. First is flexion. Flexion is nothing but the bending that happens in any joint. So this decreases the angle between the bones. Whereas the opposite of flexion is called as the extension, that increases the angle between the bones and straightens the joint. For example, in the elbow joint, the flexion here, this is the bending of the joint where the angle between the bones are reduced, and the opposite is the extension where the joint is straightened and the angulation is raised. In wrist joint also we can see the flexion of the wrist and extension of the wrist where the angulation is decreased as well as increased respectively. The forward bending of neck is flexion. The backward bending of neck is extension. In knee joint, the folding of knee refers to flexion and the straightening of knee refers to extension. The lateral bending of the body or otherwise the neck is called as lateral flexion, which is commonly associated with the neck and spine. The term abduction, it refers to the part of the body that is moving away from the midline. For example, in the palm, just you consider this middle finger as the midline, and the fanning out of the fingers away from the midline is called as abduction, whereas the opposite is called as adduction. Here, towards the middle finger, all the other fingers are coming close together or added just to the middle finger. This is called as adduction. So abduction is moving away from the body, whereas adduction is moving towards the body. So here we can see the upper limbs abduction and adduction as well as the lower limb abduction and adduction. This is the term that happens only in the temporomandibular joint. So here the mandible, the movement of mandible moving downwards during opening of mouth is called as depression, where the mandible will be depressed. The opposite is the elevation. It happens during the closing of mouth where the mandible is moved upward. This term also that is confined with the mandible. So here the movement of mandible towards the forward aspect is called as protraction, and the reverse movement is called as retraction where the mandible is pulled backward. And in the upper limb as well as in the neck, we can able to turn the heads to the sides, right side as well as the left side, and we can able to move the upper limb to the lateral side and we can bring it towards the body. So this we call it as mainly rotation. So rotation, here we have two types, lateral rotation and medial rotation. Lateral rotation is the movement which happens away from the midline of the body and occurs in the transverse plane. Whereas the medial rotation, it is the movement which happens towards the body and also it occurs in the transverse plane. Circumduction, it is a combination of movements. For example, bowling in the cricket. Here the flexion, abduction, extension as well as abduction occurs. So the combination of all the movements happens in the circumduction. This is a movement that is confined only with the upper limb. So here in the first picture we can able to see the palm as well as the forearm which is facing upwards. So this position or this movement is called as supination, or it is in the supinated condition. When the palm as well as the forearm is facing downwards, it is pronation or in pronated condition. In Tamil simply we say summa pota supination, porati pota pronation. It is a mnemonic, easily you can able to remember. And this term is also confined with the upper limb and it is very special only to the thumb. So here the term is called as apposition. During apposition, the thumb is rotated around its long axis and it helps in touching the tip of all the other fingers. So simply we say the touching of tip of all the other fingers is called as apposition, which is done only by the thumb. The movements in relation with the thumb. So here we can able to see the thumb moving away from other fingers is called as abduction. The thumb which is getting close to the other fingers is called as adduction, and straightening of the thumb is called as extension, and the folding of thumb is called as flexion, and touching the tip of other fingers is called as apposition, and bringing back the thumb to its original position is called as reposition. And here in the foot we have certain terms used. So here when the foot is pointed more downwards or inferiorly, we call it as plantar flexion. So here in the foot we don't have extension. So the opposite of flexion should be extension, but here when the foot or when the toes are just extended and facing upwards, here we call it as dorsiflexion. So plantar flexion, the opposite is the dorsiflexion. And these terms are also confined only with the lower limb with the foot. It is the rotation of the foot around its long axis. The term is inversion, which means the movement of the sole towards the medial direction. The opposite is eversion. Eversion means outside. So it represents the movement of the sole towards the lateral direction. If you find this video useful, share and subscribe the channel and hit the bell icon to get the updates immediately. Personal anatomy coaching classes as well as PG NEET coaching classes are undertaken. Students, those who are interested, can contact in the email ID given below. I'll meet you in the next video. Bye-bye.